do insurance companies typically pay for any of the stem cell treatments that we talked about? Are some in favor or some out of favor?
Right. So, like with all things, this is a moving target, but typically PRP has not been covered by most insurance carriers as an outpatient procedure, meaning, you want PRP treatments for your knee, or as Dr. Perlmutter described, say for something like tennis elbow. There are very few that will actually pay for that. That's starting to change as PRP is being shown to be a very valuable treatment. But be prepared, if you're interested in this, there may be some cost you have to bear to have this done. The good news is PRP is not extremely expensive, hundreds of dollars, not thousands of dollars. Stem cells, so the BMAC treatment we talked about, bone marrow acquired cells, most university centers in metropolitan areas that are doing this on a regular basis and have set up clinics to do this, it's like plastic surgery. It's all cash from the barrelhead. The last time I was at a meeting and I heard this discussed, I think the typical treatment is costs, soup to nuts, is about $3,000. So thousands of dollars, not hundreds of dollars. So I think with time, as these treatments become more commonly used, I think we'll find that the cost will come down, and as we prove that these are advantageous to treat arthritis, to treat some of these other conditions for which we've only had the option of surgery, I think the cost savings that you can get, as expensive it is to go to the hospital and have a big operation, if we can treat you with something that can be done in an outpatient setting, then that will probably drive the change. And insurance companies will be much more interested in paying a few $1,000s versus tens of thousands of dollars.
Absolutely.
For an operation.
I want to mention with PRP, a lot of people may have heard that they're really promoting it for hair growth.
Yes.
As people are balding and whatnot, you can get, that, so that just shows it's been around and is being used to really help people's, regenerate a lot of things.
It's done thousands of times a day in this country where there's a process called microneedling on the scalp. It stimulates an inflammatory reaction, and it using PRP or exosomes or other stem cell products, it drives those stimulating chemicals deep into your scalp, and hair follicles that are still there will proliferate. A lot of great documentation that it works in that scenario, which is proof that it could work almost in any scenario.
And
if
very
applied,
safe.
And if applied correctly and very safe. It works for men and women, and that's also done even locally.
Well, keep in mind, back to the safety issue, just to reiterate, in case you didn't hear it the other 3 times we mentioned it, is that these are your cells treating you. These aren't anybody, this isn't a drug, this isn't anything other than your cells being used to treat you. So that's why, from a safety standpoint, that's one of its strengths, I believe, that because many times we use things, chemicals, drugs, other things to treat that are not native to your body. This is taking your own cells and using the chemicals that your own body emits, concentrating them and using them to help you heal.
And that's a really important point to hear, because if you read about stem cells and the application of stem cells, many people throughout the world are using stem cells from embryos or stem cells from umbilical cords, or the part of the umbilical cord that's close to the embryo as opposed to the part that's close to the mother. And the closer that you get to the baby, the greater the chances that those stem cells can cause cancer. We can lower that risk tremendously by isolating the part from those stem cells. We can actually eliminate the risk of cancer completely by not giving any cells, but using parts of the cells, the chemicals that are in those cells. Again, they're called exosomes. and increase the healing potential tremendously. And that's something that Medicare is actually paying for now. Actually, the commercial insurances are not paying for it, but the U.S. government has recognized its value, and there's a whole collection of diagnoses that they will actually pay for the purchase and the application of this stem cell derivative product, which has only been available this year. So the field is exploding, and when the average person goes online and reads about it, because COVID has shown us that not reading skilled medical information and misinterpreting it can scare the hell out of you. It's probably one of the biggest reasons why many people aren't vaccinated yet, because they don't have a true understanding of the safety profile of the vaccine, justifiably based on what you could read on social media. But when you read about stem cells on social media, you'll read about causing cancer and things like that. That doesn't happen in the United States. The stem cell products that we're talking about are 100% safe, particularly if we use your own. But if they're harvested and we only use stem cell products from umbilical cords, they are also 100% safe. And insurance companies are beginning to pay for it. Yeah.
I want to say, you mentioned that sometimes people won't come to you because they're concerned about surgery. My husband had surgery done by you recently, and I cannot say enough nice things about Nash UNC's surgical unit. The staff there, it was just, of course, I wasn't the one having surgery, but everybody was just as good as they get, as good as you could get. I mean, I don't see how, and they were very pleased about working with you, and I'm sure Dr. Martin, you also, but I think people can really feel that we've got a top flight surgical place here if indeed they need to have surgery.
Oh, I think so. I mean, Rob gets the, one of the few surgeons that gets the highest scores of patient satisfaction in the entire UNC system.
Congratulations. Wow.
He's extremely appreciated by his patients, and that's because we share the same work ethos about treating people like family and not pushing people to surgery. But not just in our group, the entire Nash surgical group, whether they're within our group or our partners or even our technical competitors in the orthopedic world, everybody strives to do an excellent job. You're not going to get better trauma care than anybody other than Eddie Hasty. You're not going to get better spinal care by the neurosurgery team or the spine orthopedics teams that we have. A young sports medicine guy that is phenomenal, Dr. Clay Nelson. And those are people that are not part of our actual team, but are there. The new general surgery team that's there is phenomenal. The anesthesia team is second to none anywhere in the world. And so kudos to Lee Isley for putting together, and his team for putting together a wonderful management team that stimulates the health of the medical team, so that we can continue to offer excellence.
Yeah.
It's really an administrative driven thing.
So I think, to your point, the thing that makes the patient experience a good one is getting back to what I said, I think earlier, most people, the biggest thing is that anxiety, that fear of the unknown. And if you have a group of people that are happy and friendly and create a relaxing environment for you, it reduces that in your experience. I mean, if you weren't a little nervous, you wouldn't be normal. I mean, it makes me a little nervous when people aren't a little nervous, but as a general rule, if you can make that, ease that anxiety, and I think that's the goal of the staff. I think the nurses in pre-op, the nurses in post-op, everybody, nurses in the OR, the anesthesia staff, our goal is to try and make you as comfortable and relaxed as you can be going into surgery, because we also know that if we can relax you going into surgery, you tolerate the operation better, you tolerate anesthesia better, you come out of the operation more relaxed and less stressed. And so I think our staff does a fantastic job doing that.
Oh, yeah. And PT, because he's had to go to physical therapy. And
Amazing.
They absolutely know. You all give the best instructions to the physical therapists because they know, oh yeah, this is what Dr. Perlmutter likes, and this is what Dr. Martin likes.
And they cater to our individual needs. And and Nash has a wonderful therapy team. Our office has an unrelated but wonderful therapist. And there's fine therapists all through our community. Vida and Edgecombe has amazing therapy department as well. Manual physical therapy in town is phenomenal. We are just surrounded. You can't make a bad therapy choice in our community.